welcome to Half Hour to Health. I'm Dr. Dietrich. I have a great show for you women out there today because we're going to be talking about alternative methods for women's health problems. We're going to be talking about PMS. What about menopause? And how about osteoporosis, just to name a few. My guest on the show today is Dr. Beth McDougall. Dr. McDougall is from the San Francisco Preventive Medical Group. She's a graduate of the University of Minnesota and is trained in internal medicine. She specializes in using natural approaches to help modulate the course of chronic illness and helps people to optimum health. She gets down to the bottom cause of these particular problems, the root cause, instead of just treating symptoms. It's going to be a great show for you women out there, so stay tuned as Dr. McDougall and myself discuss a lot of these issues today. Dr. McDougall, pleasure having you on the show today.
Thanks a lot.
I know we have a lot to talk about here today, so let's talk about some of these conditions. What kind of conditions do you treat daily, female conditions, in your office?
Well, I see women of all ages, so I treat everything from premenstrual syndrome, menstrual irregularities, perimenopause, menopause, preconceptual care. Sometimes I'll help women with some adjunctive treatments for reproductive cancers.
Wow, interesting.
Yeah.
What about, let's talk about, I hear PMS. Everybody talks about PMS. What is PMS?
PMS actually stands for premenstrual disorder.
Okay.
And it is where women have predictable symptoms that coincide with certain points in their menstrual cycle.
Interesting.
So women sometimes complain of mood shifts, mood changes, and irritability, maybe a few days leading up to their period. Some women actually get quite depressed.
Wow.
Some women have some insomnia for a few days before their menstrual cycle starts. Other women complain of just fluid retention, bloating, breast tenderness. There's a whole host of symptoms.
So these are pretty common symptoms of the symptoms that you're talking about right now.
Right.
Now, do most women experience PMS, would you say, or is this?
I would say probably about 65% of women have some level of PMS.
So it's quite a few women that do have PMS then. And so what kind of treatment should we say that would you use on people that have PMS, or is there a lot of treatment or a lot of different things that you might do?
Well, there seem to be different underlying factors for each person.
Sure.
And so treatment really first involves kind of exploring what those underlying factors might be. So I look at hormonal balance.
Gotcha.
Occasionally women will have a situation where they produce too much estrogen and not enough progesterone.
Gotcha.
And they will end up with certain symptoms like breast tenderness and swelling. And hormones all have quite a bit of central nervous system effect. So occasionally, you know, it'll be a hormonal imbalance that will underlie some of the mood changes that a woman has. So oftentimes I'll do some testing at like a particular point in the menstrual cycle and take a look at where their hormones are. And if there are imbalances, I can help them with that.
Okay. So in other words, you're going to be balancing the hormonal system. Is that what you're saying?
Working to, yes.
Working to balance that system instead of saying just maybe prescribing some kind of a drug or whatever.
Exactly, right.
Okay.
Occasionally, if a woman has too much estrogen, it's actually because her liver is a little bit sluggish and it's not clearing the estrogen adequately. That's one of the liver's jobs, is to clear the hormones out of our bodies. And if the liver's a little sluggish, sometimes the hormone levels will accumulate. And so sometimes all a woman needs is just a little bit of support for her liver, kind of a cleansing and detoxification regime, and she'll then start handling her hormones effectively.
Interesting. So you're giving something to the body to get the body more balanced, is that what you're saying?
Exactly, yes.
So in other words, if somebody's just taking, say, just straight estrogen, synthetic estrogen, that might not be the answer sometimes.
Right.
It just depends, right?
Right, and sometimes that can even make the problem worse.
Oh, okay. So you're getting down to the underlying cause of that. That's very, very interesting. So you're giving them full health. Their health is coming back in order. So then the PMS possibly would clear up then. Is that correct?
Right. And then other things to look at are whether or not they have any nutritional deficiencies.
Gotcha.
One symptom that some women have, not prior to menstruation, but as soon as their menstruation starts, is that they have bad menstrual cramps. And occasionally in that setting, a woman is deficient in certain essential fatty acids.
Interesting.
Essential fatty acids are involved in governing whether or not your body makes pro-inflammatory molecules, or
Gotcha.
and actually cramps are an inflammatory process. So sometimes if you can give a woman the essential fatty acids she lacks, they won't have as many cramps because they won't be as prone to inflammation.
Interesting. It's interesting the way you approach these particular problems then. So you're looking at everything in that body, nutritionally,
Yes.
hormonal, instead of just saying it's just one thing then.
Right.
So in other words, by taking, say, essential fatty acids, might get the hormonal system in balance a little bit.
Definitely.
That's really interesting. Now, what about we hear about menstrual irregularities. I mean, a lot of people, a lot of women have that. We hear that in athletic type of women, that they don't have their menstrual cycles, they're not normal. What can you say about something like that?
Well, that is absolutely true, that occasionally if a woman is extremely athletic and brings her body fat count down below a certain point, she won't produce adequate levels of hormones. And you know, the menstrual cycle is very much tied into a delicate balance of hormones. Occasionally, a very athletic woman will stop ovulating, and the menstrual cycle is very tied into that monthly release of egg in the mid-cycle. And so if that's the situation, I usually try to counsel the woman on diet, and it's not that she always has to limit her exercise, but just increasing the levels of fat and protein in her diet can sometimes bring her hormone levels back up to normal.
Okay.
For other women who haven't gotten their body below a certain body fat, occasionally thyroid disorders can lead to menstrual irregularities. It's very common. There's about a few different points in a woman's life when her thyroid may become dysregulated. And one is at the onset of puberty and onset of menstruation. Another is during childbirth, and then finally is during perimenopause. And so it's, for women that kind of have irregular menstrual cycles right from the very beginning, it's useful to take a look at how well their thyroid is functioning.
Okay, interesting. Now let's talk a little bit about athletic type of women as an example. Now say with women that are very athletic and their body fat count is very, very down, can we say maybe taking some essential fatty acids will get their hormonal balance back into order again?
That can often be very helpful, very helpful. And you know, it's actually helpful to eat more cholesterol in those situations.
Eat more cholesterol.
Which is contrary to what everyone else talks about. But in those situations, sometimes the woman needs to eat more fat and more cholesterol-containing foods, because all of our hormones, all of our steroid hormones, and estrogen, progesterone, or steroid hormones, start from a molecule of cholesterol.
That's interesting. Because see, we live in a day and age where they're saying, low-fat diet. Don't eat no fat because you're going to get fat.
Right.
What is this now about? If you eat more fat, sometimes you won't get fat. You'll just get your system balanced out, and maybe even, I heard, lose weight also from eating fat.
Yes, that is true in some circumstances. Whether we put fat in our fat cells or not depends on how well our insulin works. And this gets a little bit technical.
Sure.
But as you eat a meal and your blood sugar goes up, our pancreas makes insulin to bring our blood sugar back down to normal.
Exactly.
And insulin has to bind to a receptor in order to do its job.
Okay.
And sometimes the receptor doesn't work very well. And so it takes more insulin to do the job that less used to do.
Gotcha.
And insulin promotes fat storage in fat cells. So if you can do things to make the insulin receptor work better, you can often bring the insulin level back down, and you're not as prone to putting fat in your fat cells. And one of the best things you can do is take